Welcome to the Bloodborne Pathogen and Exposure Control Plan training. OSHA requires that employers protect their workers from exposure to bloodborne pathogens. Today, we will discuss 5 Stars Plan to control exposures and what you need to know to protect yourself from exposure and possible illness. Today's goal is that you will understand the risks associated with exposure to bloodborne pathogens, meaning the illnesses that can result from coming in contact with blood or other potentially infected material. Also, we will look at the OSHA standard and what is contained in the Bloodborne Pathogen Standard and Needle Stick Safety and Prevention Act. We'll look at the Exposure Control Plan and where you can find that plan in your community. You will learn how to recognize workplace hazards and how to avoid exposure. You'll learn why and how engineering and work practice controls are used. We'll talk about the use of PPE and how it is selected. Lastly, you will know the steps to take in case you or your coworker have an exposure involving blood or other potentially infected material. There are over 5 million workers in healthcare, public safety, and other facilities at risk for exposure to bloodborne pathogens. Workers at risk include physicians, nurses, emergency room personnel, housekeeping personnel, laundry workers, laboratory and blood bank technicians, firefighters, paramedics, home health care workers, nurses' aides, and many more. All employees with exposure to blood and other potentially infected material while performing their job duties are covered by the OSHA Bloodborne Pathogen Standard. At 5 Star, we consider all our employees at risk for a bloodborne pathogen exposure. You may encounter a resident who has fallen or has a medical emergency. You may assist a coworker with an injury. Whatever your job, you should know how to protect yourself from the risk of bloodborne pathogens. To better understand the risk, we need to understand some definitions. What are bloodborne pathogens? Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus. Other potentially infectious materials, called OPIM, refers to these body fluids: semen, vaginal secretions, cerebrospinal fluid or the fluid around the brain and spinal cord, synovial fluid or the fluid in joints, pleural fluid around the lungs, pericardial fluid around the heart, peritoneal fluid in the abdomen, amniotic fluid around a fetus, saliva during dental procedures, any body fluid that is visibly contaminated with blood, and all body fluids in situations where it's difficult or impossible to differentiate between body fluids. Note that unless visibly contaminated with blood or other potentially infected material, these bodily fluids are not included: vomit, feces, tears, urine, sweat, or spit. So what is an exposure? An exposure occurs when blood or other potentially infected material comes in contact with broken skin or mucous membranes of the eyes, mouth, or nose. Broken skin includes skin that is scraped, abraded, with a rash, or otherwise not intact. This allows the possibility of bloodborne pathogens to enter the body. By far, the most common exposure comes from contaminated needle sticks. It is estimated that 600,000 to 800,000 needle stick injuries occur each year in the United States. Contaminated sharps are any contaminated object that can penetrate the skin, including, but not limited to, needles, scalpels, broken glass, broken capillary tubes, and exposed ends of dental wires. Why is the exposure to blood or other potentially infected materials so important? Let's look at the risk and the seriousness of the illnesses involved. The risk of exposure to bloodborne pathogens includes developing the following illnesses: HIV, hepatitis B, and hepatitis C. Hepatitis is inflammation of the liver that can result in acute and chronic inflammation, illness, and in some instances, death. Let's look at each of these in detail. Hepatitis B is a serious life-threatening disease that can cause jaundice, nausea, fever, and abdominal pain. If infected, symptoms may not show for 6 weeks to 6 months from the time of exposure. In adults, approximately 1/2 of newly acquired Hep B infections are symptomatic, and approximately 1% of reported cases result in acute liver failure and death. Hep B virus is found in highest concentrations in blood and lower concentrations in other body fluids. But the Hep B virus is unique in that it can survive for at least 1 week in dried blood on surfaces or contaminated needles. Hep B is much more easily transmitted than HIV. The risk of infection from a single needle stick is 6% to 30% if you do not have the Hep B virus vaccine. However, receiving the Hep B immune globulin post-exposure treatment and the vaccine is greater than 90% effective in preventing the Hep B infection. This is why it is so important to report a needle stick and to get prompt medical care. The most common chronic bloodborne infection in the United States is hepatitis C. Approximately 3.2 million persons are chronically infected. Needle stick injury is the most common occupational cause of Hep C, but it is not the most common cause overall. That appears to be illicit IV drug use. 60 to 70% of persons with a new hepatitis C infection are typically without symptoms, or they only have a mild clinical illness. However, chronic Hep C infection develops in 70 to 85% of those infected, and of those, 60 to 70% have evidence of active liver disease. The majority of infected persons might not be aware of their infection because they're not clinically ill. However, infected persons serve as a source of transmission to others and are at risk for chronic liver disease or other Hep C related chronic diseases, even decades after infection. No vaccine is available for hepatitis C, and there's no post-exposure treatment that's effective at this time. HIV is the human immunodeficiency virus that can lead to acquired immune deficiency syndrome, or AIDS. The Center for Disease Control estimates that more than 1 million people are living with HIV in the U.S. 1 in 5 of those people living with HIV is unaware of their infection. Although the number of cases of HIV infection has stabilized and is no longer increasing every year, the number is still too high. 50,000 people become infected each year. The risk of HIV infection from a needle stick is 1 in 3,000, or 0.03%. There is currently no vaccine that can prevent the HIV infection, and currently no cure exists. Further information on HIV and other bloodborne pathogens are available. Please let your supervisor, the trainer, or HR representative know if you would like more information. Now, let's review. What does OPIM stand for? Other potentially infected materials. OPIM includes which of the following? Vaginal secretions and semen, saliva and dental procedures, any body fluid that is visibly contaminated with blood, any body fluid that is unknown, or all of the above? The answer is all of the above. Question number 3. Contact with blood and OPIM puts you at risk for what 3 serious illnesses? Can you name them? They are hepatitis B, hepatitis C, and HIV and AIDS. Next question. Which of the 3 bloodborne pathogen illnesses can you be vaccinated against? Is it hepatitis B, hepatitis C, HIV and AIDS, or all of the above? The answer is hepatitis B. Next question. How long can the hepatitis B virus survive on a countertop or needle? Is it 24 hours, 5 days, at least 1 week, or 1 month? The answer is at least 1 week. Next question. Which has a higher rate of transmission from exposure to blood or other potentially infected materials? That is, you are more likely to be infected. Is it hepatitis B or HIV? The answer is hepatitis B. It's 30% chance of becoming infected as compared to 0.03% chance with HIV. What is the exposure control plan? When talking about bloodborne pathogens exposure prevention program, we are really talking about the exposure control plan. This plan details in writing your community's specific plan for reducing exposures to blood and explains what steps to take if an exposure occurs. The plan specifies all steps to be taken by your community to protect workers. The plan is reviewed at least annually to reflect any changes in tasks or procedures or assignments that might affect your exposure, and to reflect any technology that's been introduced that will eliminate or reduce exposure. The plan must document involvement of employees and the employer's consideration and implementation of safer medical devices. This plan is accessible to you, so take the opportunity to see for yourself. Ask your trainer where the exposure control plan is kept. The exposure control plan contains some very important information. The first section is the determination of employee exposure, or what tasks involve potential exposures and what controls are in place. The next several sections talk more about these controls. These sections include standard precautions, engineering and work practice controls, personal protective equipment, housekeeping, how to clean up a spill, laundry procedures, how to handle soiled linen, and how do we handle medical waste in our community. Next, there's a section on the hepatitis B vaccination program, how it's offered, and the exposure control plan also has a step-by-step procedure to follow in the case of a needle stick or other exposures, along with the necessary forms to be completed. The plan also talks about how hazards are communicated, how the training will be done for our employees, what records will be kept, as well as the procedures we follow for evaluating circumstances around an exposure incident to find out what went wrong and how these incidents can be prevented. The first required element of our exposure control plan is exposure determinations. These contain the job title, the department, the task, and control measures to be taken for each job. There's a template on the knowledge base that is downloaded and customized to your community to make sure that it fits your working exposures. The managers or supervisors are responsible for ensuring this information is accurate. Please note, all staff including part-time, temporary, contract staff, and per diem personnel, are all covered under this requirement. Universal or standard precautions is an approach to infection control to treat all human blood and certain body fluids as if they were known to be infectious for HIV, Hep B, and other bloodborne pathogens. The Center for Disease Control recommends and OSHA requires the use of standard precautions for the care of all residents, regardless of their diagnosis or what we think their infection status might be. Standard precautions are used whenever you come in contact or you anticipate that you will come in contact with blood, body fluids, secretions, and excretions except sweat, regardless of whether or not they contain visible blood. It also applies to coming in contact with non-intact skin and mucous membranes. Standard precautions are designed to reduce the risk of transmission of microorganisms from both recognized and unrecognized sources of infection in healthcare. Standard precautions includes the use of appropriate PPE or personal protective equipment, such as gloves, gowns, and masks. It also includes the use of engineering and work practice controls, such as the use of sharps containers and hand washing. Let's look closer at how these three types of controls are used to control the risk of exposure to bloodborne pathogens. Engineering controls may change the environment or the tools we use in order to isolate or remove the bloodborne pathogen hazard from the workplace. They include self-sheathing needles and sharps disposal containers. There are specific guidelines for selecting and evaluating needle-safe devices, and these should be followed. Remember, the engineering controls must be used in combination with work practice controls and personal protective equipment. For example, be sure to use hand washing facilities or appropriate antiseptic hand cleaner. Know where to find these in your community. Each 5-star community must order needle-safe devices from the 5-star formulary. 5-star does not purchase add-on safety devices, and these should not be used in our communities. The one-handed sheathing mechanisms are preferable, but where not available, the tube sheath is acceptable. Standard precautions should prevail and follow safe work practices, such as no recapping, keep sharps containers by the person given the injection, and so forth. Use syringes, meaning those that have been activated, must be placed in a sharps disposal container and treated as regulated waste. For IV therapy, 5-star uses a needleless system. A needleless system means a device that does not use needles after the venous or arterial line is established to withdraw bodily fluids or to administer medications or fluids or any other procedure that would involve the potential for an exposure incident. Needle or needle devices means a needle of any type, including but not limited to solid and hollow bore needles. Another required element of the exposure control plan is work practice controls. These measures reduce the likelihood of exposure by changing the way in which we do the job. An example of this is prohibiting recapping of needles using a two-handed technique. Again, these controls must be used in combination with engineering controls and PPE to minimize or eliminate employee exposure. Can you think of some other work practice controls? Hand washing is one. Our exposure control plan contains the following work practice controls. Do not shear or break contaminated sharps. Do not bend, recap, or remove contaminated needles and other sharps. OSHA defines contaminated as the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. Also prohibited are opening and emptying or cleaning sharps containers in a way that would expose employees to sharp injuries. Also prohibited, reusing disposable sharps. Remember, discard contaminated sharps immediately or as soon as feasible into appropriate containers. Do not pick up contaminated broken glassware, or any glassware for that matter, by hand. Use mechanical means such as a brush and a dustpan, tongs, or forceps. Hand hygiene is often cited as the single most important practice to reduce the transmission of infectious agents in healthcare settings. The term hand hygiene means both hand washing with either plain or antiseptic containing soap and water, or the use of alcohol-based products, the gels, rinses, foams that do not require the use of water. Remember, if there has been contact with blood or other potentially infectious material, you must wash with soap and water. If not, however, waterless cleansers may be used. Did you know that the type and length of your fingernails has an impact on the effectiveness of hand hygiene? It can dramatically reduce the effectiveness. Remember to remove garments penetrated with blood or other potentially infectious materials immediately. Designated containers for used PPE should be placed in a location that's convenient to the area where it is removed. Hand hygiene is always the final step after removing and disposing of PPE. So remember, it's remove, dispose, and wash. Always minimize splashing, spraying, or dispersing of blood or other potentially infectious materials into the air. Remember, do not eat, drink, smoke, apply cosmetics, or handle contact lenses where there's a reasonable chance that blood or other potentially infectious materials have been there. Do not store food and drink in refrigerators, freezers, shelves, or in areas of possible contamination. We always try to control risk of exposure with engineering controls and work practice controls first. But when the risk of exposure still exists after they have been put in place, then personal protective equipment, or PPE, must be used. PPE refers to a variety of barriers used alone or in combination to protect mucous membranes, airways, skin, and clothing from contact with infectious agents. It is selected and provided to you at no cost. When there is a possibility of exposure, PPE must be worn. The PPE is selected specifically for the task so that the level and type of protection fits the expected exposure. That's why you will be trained on what PPE to wear for what task. For example, when splashes, sprays, splatters, or droplets of blood or other potentially infectious material pose a hazard to the eyes, nose, or mouth, then masks are worn in conjunction with eye protection, such as goggles or glasses with solid shields, or perhaps chin-length face shields are to be worn. Protection against exposure to the body is provided by protective clothing, such as gowns, aprons, lab coats, and similar garments. Be sure to remove PPE before leaving the work area. OSHA requires a clean and sanitary work environment to prevent contact with blood or other potentially infected materials. You can find the written schedule for cleaning and methods of decontamination in the exposure control plan. This written schedule is based on the type of surfaces to be cleaned, the type of soil present, the tasks or procedures to be performed in the area, and the location within the facility. All equipment, work surfaces, and reusable items must be decontaminated after completion of procedures, or when items are contaminated, or at the end of the work shift. An approved disinfectant must be used, because remember that hepatitis B virus can survive for at least 1 week in dried blood, on environmental surfaces, or contaminated needles. Let's talk about appropriate disinfectants. These include a diluted bleach solution, usually with a ratio of 1 to 10, or EPA-registered antimicrobial products, such as shown here, List B being a tuberculoticide, List A, sterilants, and so forth. These products are classified into categories indicating the effectiveness against certain viruses. Be sure to ask your trainer about the written housekeeping procedures followed at your community. There may be special instructions for cleaning with these agents, such as how to store the agent, what PPE to wear, and the time to leave the surface wet after disinfecting. The exposure control plan explains how to handle contaminated waste so the risk of infection is minimized. By regulated waste, we mean any waste generated in the diagnosis, treatment, or care or immunization of another person that contains sufficient pathogens so that the exposure to that waste by a susceptible person could result in an infectious disease. What do you consider regulated medical waste? Anytime material is dripping or caked with dried blood, it must be disposed of as regulated waste. Some examples would be blood-soaked bandages, perhaps culture dishes or other glassware, discarded surgical gloves or instruments, discarded needles or lancets are all considered regulated medical waste. In order to ensure regulated waste is disposed of safely, it must be placed in closable, leak-proof containers or bags built to safely contain all contents during handling, storing, transporting, or shipping. These bags or containers must be color-coded and labeled. For contaminated sharps, the container or bag must also be puncture-resistant. Shown here are two of the most common ways you may see regulated waste in our communities. The first is bags of regulated waste. These bags will be color-coded red and labeled as biohazard with the International Biohazard symbol or as biohazardous waste. The labels do not need to be orange or orange-red. The second type of container are those for contaminated sharps. These are identified with the International Biohazard symbol. When you go to move a sharps container from the area of use to the place of disposal, be sure just prior to moving it, it is closed to prevent spillage or protrusion of contents. You will see biohazard warning labels on other containers throughout the community. Warning labels should be attached to containers of regulated waste, refrigerators and freezers containing blood or other potentially infectious material, and other containers used to store, transport, or ship blood or other potentially infectious material. The warning labels are either part of the container itself or are attached as close as possible to the containers by string, wire, or adhesive to prevent the labels from being lost or removed unintentionally. The warning labels must meet three requirements. First, they are predominantly fluorescent orange or orange-red. Secondly, they have lettering and symbols in contrasting colors. And three, they have the following words: either biohazard with the International Biohazard symbol, or in the case of regulated waste, it will say biohazardous waste or sharps waste. Warning labels are not required for the following types of containers: bags or containers that do not contain sharps or other types of regulated waste, or containers of blood components or blood products that are labeled as to their contents and they've been released for transfusion or other clinical uses. And thirdly, warning labels are not required for individual containers of blood or other potentially infectious material that are placed in labeled containers during shipping, transport, or storage. Contaminated laundry means laundry that's been soiled with blood or other potentially infectious materials, or may contain sharps. To minimize exposure to blood or other potentially infectious materials, handle contaminated laundry as little as possible, with minimum agitation. If you come into contact with or handle contaminated laundry, you are required to wear protective gloves and other personal protective equipment. In addition, contaminated laundry is bagged or containerized without sorting or rinsing at the point where it was used. Contaminated laundry is also placed and transported in leak-proof bags or containers when wet, or it's likely that the fluids may soak through or leak to the exterior. Contaminated laundry is placed in bags or containers that are labeled and color-coded as described below when it is shipped to off-site facilities. So contaminated laundry is placed and transported in color-coded bags, in this case red bags, that are labeled in the following manner. The label is an integral part of the container or attached as close as possible to the container to prevent loss or unintentional removal. The label is predominantly fluorescent orange or orange red, and the symbols are in contrasting colors. Also, contaminated laundry without sharps is labeled as biohazard with the International Biohazard symbol. Let's talk about another way you can protect yourself from hepatitis B. The hepatitis B vaccination series is available to all employees who are exposed to bloodborne pathogens at work. The vaccination will be made available to you after you receive further information about the vaccine and within 10 working days of beginning your job assignment. The series is made available unless the employee previously received the complete hepatitis B vaccination series, or antibody testing shows that the employee is immune, or the vaccination series is not recommended for medical reasons. 5 Star strongly encourages employees to be vaccinated because we recognize that all employees may be exposed to blood or other potentially infectious material while at work, and this exposure places them at risk for contracting hepatitis B. Hepatitis B can be prevented using this vaccine. Therefore, this vaccination program is an essential part of our prevention and infection control program. The more employees who are immunized, the more it protects the health of our employees, their families, and our residents from the disease. Accepting the hepatitis B vaccination series is not a condition of employment. If an employee with occupational exposure initially decides to decline the hepatitis B vaccination series, but at a later date decides to accept it, it will be made available at no cost. Each employee who declines the hepatitis B vaccination series is required to sign a waiver. This is a document that verifies that you understand the risk of acquiring hepatitis B and that you have been given the opportunity to receive the vaccination. It goes on to say that you are declining the vaccination at this time, but know that if in the future you still have exposure to bloodborne pathogens at work, you can receive the vaccination free of charge. What if an exposure occurs? First, immediately wash the exposed area with soap and water, or flush splashes to the nose, mouth, or skin with water. Irrigate the eyes with water or saline, and report the exposure to your supervisor. This is very important. It is time sensitive, and you will be directed to a healthcare professional who can administer post-exposure treatment as recommended and offer counseling. Exposure to blood or other potentially infectious material requires timely and appropriate action. Based on the most current recommendations of the Centers for Disease Control, within 3 to 4 hours of an exposure incident, the exposed employee should receive confidential medical evaluation, counseling, lab tests, and treatment or post-exposure drugs. 5-Star will ensure that that happens and that these services are made available at no cost to our employees at a reasonable time and place. These services will be performed by or under the supervision of a licensed physician or another licensed healthcare professional, and this treatment will be kept current according to the recommendations of the Centers for Disease Control. Within 7 days of the exposure incident, the exposure route will be determined and the source individual's blood testing will be done if possible. In order to help the employee receive adequate treatment following an exposure, the healthcare professionals will be given the following information from 5-Star: the description of the employee's duties as related to the exposure incident, documentation of the route and circumstances surrounding the exposure, the result of the source individual's blood testing, relevant medical records, and the description of the personal protective equipment that was used or should have been used. We will obtain a copy of the evaluating healthcare professional's written opinion within 15 days of the medical evaluation. A copy of this written opinion is provided to the employee involved in the exposure incident. The healthcare professional's written opinion informs the employee about the status of the hepatitis B vaccination and the results of the evaluation and any medical conditions resulting from the exposure that requires further evaluation or treatment. All SHARPS incidents are recorded on the Medical SHARPS injury log. This is per OSHA guidelines and also 5-Star policy. A needle stick injury must also be reported on the OSHA 300 log. The Medical SHARPS injury log is maintained for 5 years from the date that the exposure incident occurred. The log is maintained in a way that ensures employee privacy and contains, at a minimum, the type and brand of device involved in the incident, the location of the incident, and a description of the incident. Employee medical records will be kept confidential and are not disclosed or reported to any person within or outside the workplace unless the employee has given his or her express written consent, except as required by applicable laws. Medical records include the employee's name, social security number, and a copy of the employee's documentation of the hepatitis vaccine series, exposures, and treatment following an exposure. Medical records will be maintained for at least the duration of the individual's employment plus 30 years. 5-Star will ensure that all employees, including part-time and temporary, who are exposed to bloodborne pathogens while at work, will participate in a training program that is provided at no cost and during working hours. The training will be provided at time of hire, annually, as well as with any changes. The training materials used will be appropriate to meet the needs of our employees, and they will clearly state the objectives of the training. The trainers will be knowledgeable in bloodborne pathogens and the exposure control plan as it is implemented in your community. All employees should have an opportunity for interactive questions and answers with the person conducting the training. Our documentation of this training will be maintained for 3 years. In addition, a copy of the OSHA regulations is available to all employees. Now, let's review. The exposure control plan contains a list of who is exposed to bloodborne pathogens, when and what PPE is to be worn, B, labeling procedures, C, what to do if exposed to blood, D, B and C, and E, all of the above. The answer is all of the above. Number 2, where is the exposure control plan kept at this community? Please be sure your trainer has told you where this plan is kept. It's very important that you know. Number 3, universal or standard precautions include the use of PPE and work practice controls such as hand washing. Or, universal or standard precautions, B, apply to the care of all residents regardless of their diagnosis or presumed infection status. Or C, both A and B. You are correct. Universal or standard precautions includes both of these. Number 4, what are the steps to take if you are exposed to blood or other potentially infectious materials? The steps to take are wash the site with soap and water or flush and report the incident to your supervisor immediately. In conclusion, the OSHA Bloodborne Pathogen Standard prescribes safeguards to protect employees against the health hazards of being exposed to blood and other potentially infectious materials. 5-Star has established policies and procedures to protect the employees and be in compliance with OSHA and Centers for Disease Control standards. Understand and follow the exposure control plan. Use safe work practices and reduce your risk of exposure and possible serious illness. Thank you for your time, and please work safely.